Began tonight with a mystery on the medical front. An investigation is underway as to what has caused 9 children here in Alabama to suffer severe liver disease. 2 of those children required liver transplants.
Yeah, in fact, Amanda, while medical experts are still stumped to what exactly this illness may be, Alabama is still the only state to report cases of this mystery virus. WDHN's Alex Valdez joins us from the newsroom with more details. Alex, what are the medical experts saying?
Mike, Amanda, according to state medical experts, it's difficult to say why this virus is showing up only in Alabama right now. And the million-dollar question they are scrambling to answer: what is causing this mysterious illness in children younger than 10? The Alabama children tested positive for the adenovirus, a common virus that causes cold-like symptoms and hepatitis. Although testing has ruled out hepatitis types A, B, and C, however, experts believe there will be more cases moving forward.
I think there's a lot of work to be done. I'm sure there may be some other children that may present, and we'll hopefully learn more about how this is specifically affecting the liver.
At this time, it's unknown where in Alabama the 9 children live. None of them had underlying health conditions. Other cases of this mystery virus have shown up in parts of Europe.
Right now, mystery. Our counterparts in Europe also noticing some cases. This does not appear to be related to COVID, but it is something that health officials are keeping their eye on.
Medical experts say it's important that parents know the signs. If a child has signs of jaundice, the yellowing of the skin or eyes, call a pediatrician immediately. Although nausea and fever are also factors, they aren't signs to panic. Experts say it's also important kids practice healthy habits, such as washing their hands for at least 20 seconds or more.
We kept seeing similar presentations of children coming in with similar stories of fever, jaundice, maybe vomiting or diarrhea, and clinical signs of hepatitis, and then went on to have positive adenovirus testing in the bloodstream.
In terms of treatment, experts say antiviral medications and management strategies such as liver transplants have been able to treat the virus. Medical professionals in Alabama will continue to coordinate with the CDC to continue to test children and investigate the theories into why this virus has caused such severe illness.
Does anyone have a theory? Well, we all have theories, but right now we don't have any proof or any support for that. So I believe also, in addition to our investigation, is continuing to raise awareness.
At this time, it's reported that all 9 of the children who had been diagnosed with this mystery illness are doing well, including the 2 who needed the liver transplants. Once again, medical experts say there are no common links between any of the children, which is why they say this is making the virus more puzzling. Mike and Amanda.